President, I am honoured to have the opportunity to speak to the 2021-22 annual report from the Peter MacCallum Cancer Centre. What began as a concept in a single room run off the smell of an oily rag 74 years ago in the then Queen Victoria Hospital has now grown into an internationally recognised cancer treatment centre with 5 locations across Victoria. Originally called the Cancer Institute, Peter Mac has helped countless patients and families of patients seek the best possible care they can. And the best of all, right here in Melbourne. You don't need to travel outside of our great state to get the best care and attention in the world, and I reckon that's something we should be proud of. President, in the annual report, Goals of Achievement section, there is a statistic that is completely remarkable. There is a 100% positive patient response, and it's 100% for all of the 3 quarters that it was measured in. But you can't remain the best without a plan, and Peter Mac has a plan. In 2020, they outlined the 5-year strategic plan, which details how they are going to continue to deliver and even improve on the world-class cancer treatments. Peter Mac is now halfway through its strategic plan and the outlook is good. The report speaks to the performance and outcomes metrics that Peter Mac judges itself on. This ranges from quality of care to advancements in technology and research, and I am proud to say that Peter Mac is hitting all these benchmarks. In the 2021-2022 year, Peter Mac treated over 40,000 inpatients, ranging from haematology to melanoma. They also completed 285,000 specialist appointments. But we know that despite being lucky to have Peter Mac in the heart of our city, it can still be hard for rural Victoria to access these services. That's why I'm proud that they're doubling down on their efforts to make the services more accessible to any Victorian that might need their services. This includes increasing their numbers to telehealth appointments by 28%. So no matter where you are in Victoria, whether it be a casual worker in Metro Melbourne or a farmer on rural Victoria, you can still make that appointment and receive the world-class healthcare you deserve. Beyond existing treatment regimes, clinical services and community engagement, Peter Mac has also led the way in field of research. We're training the best and the brightest right here in Melbourne, and our advances are on the cutting edge, putting us at the forefront of the treatment and the ability to commercialise this. It's a fantastic asset to our state, and it makes us the envy of the nation. And the draw card of research, teaching and commercialisation is attracting talent and students from right across Australia, and we need right around the world. And it helps cement our role as the education state, home to the next generation of scholars, researchers and academics and medical professionals. But President, we know particularly in the era of the voice how important it is to fight the ingrained and structural discrimination that many face when entering the medical profession and field. And Peter Mac is doing its part in closing it. Peter Mac's reconciliation plan is helping to advance equity in healthcare and fighting the discrimination that many First Nations people experience in the medical profession. From extensive training to culturally sensitive healthcare practices and their engagement in the consultancy firm, Peter Mac is leading the way. And through engagement with First Nation people, Peter Mac establishes the Peter Mac Cancer Centre's Aboriginal and Torres Strait Islanders Advisory Committee. We know that's listening to First Nations voices and walking with them in the best way to address their needs. And Peter Mac has also embedded an Aboriginal and Torres Strait Islands cultural safety framework in their workforce. And as a proud unionist, it's great to see that their EBA's leave policy acknowledges the unique cultural practices, tradition and needs of our First Nations staff. President, Peter Mac is on a solid path. They are continuing to deliver the best care at a time when Victorians need it the most. We all know someone who has been touched by Peter Mac in the big ways or in small. That's why I'm so proud to be a member of the Andrews Labor government that is backing our healthcare infrastructure and workforce, that is backing Peter Mac in all the way. We've delivered the record $54 billion since coming into government in 2014, with the $4.9 billion boost in this year's budget alone, and more workers, better services and the latest equipment. I know Peter Mac and the hospitals, like it right across our state, will continue to deliver from all of us. I commend the report to the House.